Well, it's that time of the year. Medicare's open enrollment period starts October 15th. Do you qualify? What options do you have for coverage? We'll answer your questions next on WNIN Newsmakers. Thanks for joining us. I'm Jessica Costello, evening anchor for Eyewitness News. Here to help explain Medicare enrollment process, we have Jessica Borman and Brooke Cahoon of the Posey County Council on Aging. Thank you guys for joining us.
Thank you. Thanks for having
us. Of course, we're excited to have you. I know this is an important topic. But first, I kind of want to start off by explaining what the Posey County Council on Aging is, because there are some viewers that may not know.
So we provide transportation services, predominantly transportation services, but many, many other things to people over the age of 65. We do trips, we do events. You can sign up for Medicare at one of our SHIP appointments. You can do exercise class, yoga. We have lots of classes that folks can come and be a part of. We have a grief group. We have caring for the caregiver. So, folks that are taking care of their parents or their grandparents, that's a tough spot to be in.
Absolutely.
And so we really want to provide support to those
it
families.
Just sounds like a really good resource to know about, but first and foremost. So we're talking about Medicare today, and this is something really important. And there even may be some viewers that are maybe on the brink of, okay, is it my time to think about Medicare, enroll in Medicare? So let's start with the basics. What is Medicare?
So Medicare at its core is healthcare for older Americans, right? It was started in the 70s with President Kennedy. And he really wanted to address the needs of an aging population. There wasn't really anything in place once you stopped working. So Medicare kind of is meant to fill that gap. From when you leave work, how are you going to take care of your health care needs from that point on? Okay, so there's lots of different versions of Medicare.
A lot of aspects to this.
Lots and lots and lots. But it's meant to provide care to seniors and certain qualified disabilities and conditions.
We start talking about qualifications, and I'm sure there are many that people know about. So what qualifications do you need to have to even think or consider Medicare?
You have to be 65 or older, or have anybody with a disability or anything like that. They can qualify too.
Okay.
Dialysis patients, anybody with renal failure or things like that, they qualify.
So maybe there's another qualification. People are like, okay, maybe that this qualifies. Is there a website or something people can go to see all of the qualifications?
You can go to Medicare.gov.
Okay.
So they lay out pretty simply in pretty plain English, but a lot of older folks don't like to get on the internet. So you can also call, Social Security. You can call Medicare has a hotline that you can get the number, pull that up for, or you can contact any council on aging as well.
So Posey County Council on Aging.
Yes,
Okay, this would be a
Posey
perfect
County Council on
resource.
Aging, right. And we work with SHIP, the State Health Insurance Assistant Program, to help sign those people up or find out what they're eligible for.
So those open enrollment dates are very important. Is open enrollment the only time people can sign up, or are there other times during the year? And if so, what are those dates? When do people need to look out for that period of signing up?
Open enrollment, or you can sign up 3 months before you turn 65, or you can 3 months after you turn 65. But you got to kind of hit it in that. If not, you'll have to wait till open enrollment or pay a penalty fee, I'm pretty sure.
Okay. And then people can find that information again on their website, just to lock in those dates and make sure they're not missing it, right?
Yeah.
Right, and some folks are auto-enrolled, some folks aren't, so it's really best if you're in that 6 month, 3 months before you're 65 or 3 months after, to just call somebody.
Yeah.
Call somebody
get
and
ahead of
find
it.
out. Right.
Okay.
Right.
Oh, yeah.
Because again, certain disabilities qualify, but other disabilities don't.
Right.
You have to be on disability for, I believe it's 24 months before they can transition you over to Medicare. But if you're on dialysis, you qualify. If you have ALS, you qualify. So there's a lot of
certain circumstances may qualify. You just need to call.
Right, and there are income parameters as well, like with Medicaid and most other government-funded programs. you have to fall into the little income bracket
Yeah,
too.
and that makes sense. I think the best part would be if your circumstance is a little bit different, or if you don't know somebody that meets that circumstance, to go on that website, to call your aging counsel, just do any of those things to really figure out if you qualify or not within that period,
Absolutely.
of course. Let's go over some of the differences between the traditional Medicare and Advantage plans. That's probably a heavy one, but can we go over that?
Yeah. So your traditional Medicaid or Medicare, it covers, you can use it at any hospital with any doctor. The majority of the time, it covers, the basis of everything. And then the Advantage plans, some of those you can either get both Advantage plans or just one Advantage plan. Then the majority of the time you will have to pay a premium for the Advantage plans. And Medicare sometimes, or the original Medicare, sometimes you don't have to. That one's kind of,
Right, it's super tricky. So
Yeah.
whenever I look at it, original Medicare operates more to me like a standard health insurance policy, right? You're gonna have copays, you've got a deductible you're gonna have to meet, all those kinds of things, but they don't cover medicine. They don't cover any kind of prescription drugs or vision plans or any of it. You can't do any of that with original Medicare alone.
Okay.
So that's kind of, I think, where the Advantage plans
Yeah, that's
come
where the-
into. So when you're shopping around and you're looking, are you a person that goes to the doctor a lot? Are you on a lot of medicine? You might want to look at an Advantage plan in that case, because they cover all sorts of different things
Right.
depending on what you choose. You can get discounts at fitness clubs
Nice.
with
That's a
some
benefit. It's a
Medicare
great
plans,
benefit,
right?
yeah.
Some of them cover vision insurance type stuff, dental care, hearing tests, but not all of them. So it's like a marketplace of choices.
So, and you probably don't know this off the top of your head, but there's an obvious maybe financial difference there too. It just kind of depends on what works for you, what your circumstances are, and things like that, right?
Right, and I do believe original Medicare is probably cheaper
Okay.
in the long run than some of the Advantage plans. But again, if you have a lot of medicine, you're going to want that Part D coverage with prescriptions.
And we're kind of touching on this next question here, but in a broader sense, what should people be looking for when they are picking their insurance companies, or when they're just shopping around for insurance? What should they be looking for?
You always want to make sure that your doctor is covered, check and make sure your doctor's covered, make sure that, the hospitals and things that you like are covered underneath that while you are shopping, because if not, then you have to pick another, doctor and all that stuff, and that's definitely not fun.
Yeah, that's hard to do once
Oh,
you're
yeah.
so used to somebody too.
Right, and I think that's number one, is making sure that your providers are covered in the plan that you choose. And if not, knowing that ahead of time so you can make those concessions. What does it cost?
Right.
What does
Big
it
one.
cost? That's probably a huge one for most folks. What was it? The Medicare Part B is $160 or $170
Okay.
a
A
month to
month.
have that coverage, and for some folks that's a lot.
Absolutely.
Yeah.
Especially with where we're at in terms of just, the cost of living right now.
Right.
Gas and things like that. So it's something that you always have to be cautious about. Are all Medicare plans accepted everywhere? I think we touched on this a little bit as well. That's difficult too, right?
Yeah.
Yeah, it's like any other insurance, right? Like it's
Yeah.
accepted some places and not others. But Medicare largely is taken pretty much everywhere.
Okay.
All your major hospitals, your major facilities like St. Vincent's or Deaconess here locally, even into Kentucky and like Louisville and Kosare, those places are covered.
But then again, if you do have to check still with your doctor and see if that gets taken there. So don't forget to do that if that's
Always
the case.
check.
Oh, yeah.
Yes.
Always check.
Just in case. So what about veterans? Veteran benefits coordinate with Medicare. Does that happen? Can that happen? Or what does that look like?
Kind of no, not really. The VA functions in their own facilities with their own providers, essentially, and then Medicare functions in their facilities with their providers, and they don't usually cross paths. The VA doesn't cover Medicare things, and Medicare doesn't cover the VA things, so they don't work together, but they do work kind of like a co-insurance situation where one can pick up some things and maybe the other doesn't.
Okay, that makes sense. Anything else to add there? I know that's probably confusing for.
The best bet on if you're a person with VA benefits, just call
Yes.
your VA.
I think
and
that's-
they will be able to guide you.
Yes, that's a common theme here. Call, look up on the website and whatnot if you have any questions. I think everybody's circumstance is so different, so it's probably best to just get on the phone. And if you don't want to get on the phone, maybe check out that website just to see if you're your situation falls in the plan to go to Medicare or
Exactly, because it's okay to not know.
right.
Right, it's okay to not
I think
know.
a lot
And
of us sometimes don't know.
Oh, yeah.
most of us don't. Medicare is like every health insurance. It's complicated.
Right.
There's lots of moving parts. It's absolutely fine for anyone to reach out to us, to SWORCA, to other agencies, and say, hey, I need some help with this. And we'd be happy to do that.
This next question, I am excited to know the answer because this is something I hear people, I think, maybe get confused about or don't really understand the difference. The difference between Medicare versus Medicaid. I think sometimes people switch them out sometimes because they don't understand they're two different things. So can we talk about the differences there, what they are like separately, and then why they are not the same?
To put it easy, right? Medicare is for aged and disabled, and Medicaid is for low income. But you can be both. You can be both. So some folks, like if you're asking, should I have Medicare and Medicaid? Well, that depends on your situation, what kind of income you have, what kind of medical needs you have, what your transportation needs maybe. A lot of folks don't know that Medicaid and Medicare will cover transportation costs to and from appointments. That's a huge thing that we do at Posey County Council on Aging.
Okay.
We take folks everywhere. We take folks to dialysis, to the grocery store, to your doctor, your eye doctor, the public library.
Yeah.
You know, we do that. And Medicare and Medicaid will cover a lot of those services.
So is that something people can have, they can have both at the same time?
A lot of folks can have both. With certain disabilities, you look at something like dialysis care and kidney disease, and you can't work with those things. You know, folks are in dialysis, 12 hours a week or something? It's a lot. It's
Yeah.
a lot of time. So a lot of those folks do qualify for both because they have a low income because they're on Social Security, but they have all these complicating health factors.
Right.
And then Medicaid just acts like a co-insurance would, and it picks up where Medicare leaves off. So you don't run into copays or, you know, a maximum out of pocket. Most prescriptions are covered at no cost if you also have Medicaid.
Right. And then that's another part of this where it's like, okay, my circumstance could match this, so let's pick up the phone and see if maybe I qualify for both of those because they're great resources. Is there anything else that we're missing here on this conversation that you guys would like to add? And we went over a lot.
It was a lot. I think really just reach out. You can't say that enough. Just reach out. Call us. We do not mind to help. We work with SHIP. Brooke's being trained to be a SHIP counselor, so we'll have a little more open availability for appointments.
Great.
To get people in, and they're an hour-long appointments. So we encourage people to sit down and just ask all the questions. If we don't know, we'll find out together. It'll be okay.
Perfect. Well, thank you both for joining us.
Thanks
you.
for having us.
Here with us now is Susan Spilly, the State Special Populations Coordinator with Indiana's State Health Insurance Assistance Program. Thank you for joining us.
Oh, I'm glad to. Thank you so much for asking.
Of course. So let's start off pretty broad here. What is SHIP?
Well, SHIP, as you just said, is the State Health Insurance Assistance Program, and we are a federally funded, housed in the Indiana Department of Insurance Medicare counseling service. So we offer free and impartial information about Medicare and all of the associated types of insurance. So we have counseling sites all over the state of Indiana, about 400 counselors around the state. And we offer just impartial information. We don't tell people what to do. And we provide them the information to make the best decision that they can make for themselves.
Absolutely. So what about maybe the TV's on in the background, commercials are running, and they hear about these benefits that they might be able to qualify for? How does someone qualify for the free benefits that they might be hearing on TV or seeing in ads? Can you go over that?
Yes, and that is a question that we get all the time. You know, what about these free things? I want to sign up for the free thing, or I want the gift card so I can go to the grocery store or go to the gym. Well, we have to remember what advertisements are all about. So companies advertise things, and what they're doing is compelling you to action. And in this case, most of those advertisements that are talking about Medicare products are compelling you to make that phone call. So when you call the number on the screen, you're going to be linked up with an insurance company or an insurance salesperson, and they will, of course, sell you things. So that is the whole idea around advertising, compelling people to action. You know, talking to insurance salespeople is not an inherently bad thing, but they're only going to tell you about certain products, the products that they sell. And, you know, I completely understand that. The difference between seeing a SHIP counselor and an insurance salesperson, of course, is that we will tell you about all of your options because we don't sell anything. We're not insurance salespeople. We're a government-funded service, and we're housed in the Indiana Department of Insurance. So we are familiar with all of the products and the rules around those. So just be careful about those commercials that you see. Or the other thing that people are getting a lot of is mail in the mailbox. So if you think the U.S. Postal Service was dead, you're wrong, because about this time of the year, if you're anywhere around age 65 or more, you're getting tons of mail from companies. And some of that mail can be pretty tricky. They make it look like it's coming from Medicare or Social Security. And so you really have to be a good reader of that information. But generally, it's just sales propaganda. So just take your name and address off and shred that part. And then the rest of it, you can hit it with the recycle bin.
Absolutely. Susan, it sounds like I'm obviously talking to an expert about this. I'm sure you can answer this question for hours if we talked about it, but what kind of resources are available?
Right. Well, obviously, you know, SHIP, talking with a counselor one-on-one, or we can do virtual counseling, kind of like you and I are doing. You know, we can use Zoom as a platform. We can even talk to people over the phone. And of course, we'll put up the phone number to reach the main office, our call center. But what we also do is use the Medicare.gov website in helping people understand what their options are. So this is a government website. It's not linked to any particular insurance company or anybody trying to sell you anything. You're not going to see that thing pop up that says cookies preference, which means they're not capturing your information. They're not selling your names to other people that can market things to you. So Medicare.gov, G-O-V. We also have a website at Indiana SHIP, and it's medicare.in.gov. And since we're housed in the state, we are part of the big in.gov website. But if you go to that address, it takes you right to Indiana SHIP, and we have tons of great, easily accessed information about Medicare and the related types of insurance. So those are two terrific resources that you can feel safe to use.
Well, Susan, since we're kind of talking about advice here, and people may be wondering or maybe thinking about going into Medicare, it's obviously going to differ by situation. So let's go over dependents. Maybe somebody's looking at Medicare and they're like, is this going to help any dependents that I have or will need on my plan? Can you talk about if Medicare covers that?
Right. Well, this is where Medicare is completely different than your employer group plan. So with those employer group plans, most of the time you can insure dependents under your coverage. But Medicare is an individual thing. So even if you're a married couple living together, you know, you might make some Medicare choices and your spouse may make completely different choices around Medicare. So it's very individual. There's no dependent coverage. So that's important to remember, because that could be a reason why you may want to not sign up for Medicare, even though you're eligible. Because if you're still working for a large employer with credible coverage, you don't have to sign up for Medicare. And if you're covering dependents, then you know you won't be able to do that with Medicare coverage. So that's one of those instances where you may want to kick the Medicare can down the road.
Well, what about Medicare supplements, that Medigap, that people might hear that word and they're like, okay, well, what is that? Can we explain what that is as well?
Sure. Medigaps or Medicare supplements, it's the exact same thing, just two different names, is a private insurance policy that you purchase from an insurance company. So it is an arrangement, just like you buy car insurance. You're buying a policy to cover your car, if something would happen with your car. So a Medigap or Medicare supplement is an insurance policy you purchase from an insurance company that covers some or most of what Medicare doesn't. It supplements Medicare or fills in the gaps, as they say. There are a variety of policies to choose from, and they're called, unfortunately, because it does make it a little more confusing, plans. So it's plan A through N, minus a few letters that have dropped off over the years. And depending on which plan you choose, it will have a different price per month. It will cover differently. And of course, SHIP counselors can explain all the different plans and how they cover and what they cover. And then on that medicare.in.gov website that I referred to earlier, you can even get prices for yourself in a very anonymous way. You don't have to reach out to any insurance company to get prices. You can just go on our website and look at all of the different plans, what they cover. And we also have a list of all of the approved insurance companies and which plans they sell. So when you're ready to purchase a Medigap plan, if that's what your choice is, then you just have to look at our website, get the information, and make the phone call and purchase your plan.
It sounds pretty easy when you have resources like that.
Well, we like to make it easy because we know that folks struggle with Medicare information. No matter what your background is, sometimes Medicare's difficult to understand. And while there are some similarities, because it is insurance, just, we'll put it out there, it is insurance, there's similarities between what you have at your employer group plan options. But then sometimes Medicare acts completely differently. And you need to know exactly how Medicare works, what it is, how much it costs, because I like to say, how can you plan your retirement unless you know what your health insurance costs are going to be? So start out by finding out about Medicare.
Susan, one of those things that, people always want to know is about that open enrollment period. That's one of the most important things to know here, other than if you qualify for Medicare or Medigap. Can you talk about when to enroll with Medigap and if that is different than enrolling with Medicare?
Well, you have to have Medicare Parts A and B in order to get a Medigap policy, because that's the gap that Medicare fills in. Part A has deductibles, co-payments and co-insurance. Part B has deductible and co-insurance as well. So Medigap fills that in. So you have to have Medicare Parts A and B in order to even buy a Medigap plan. And there are different rules around when you can purchase a Medigap plan. And a lot of times this is triggered by getting Medicare in the first place, specifically Part B of Medicare. But there are some different rules and exclusions and inclusions. And this is why really the best thing is to contact your local SHIP counselor so you can get information based on your situation. Because you can do a broad overview of things, but everybody's situation is different. That's why we like to give general information, but for really specific stuff, talk to a SHIP counselor.
Susan, last question here. Why might someone choose to apply for a supplement or not? I know you touched on this too, but if they're looking into, okay, maybe this will work for me as well, what kind of situation do you need to be in to maybe consider that supplement?
Well, what I like to tell people is that insurance decisions, any insurance decision, is based a lot on someone's tolerance for risk. So there are people who say, I know I'm going to pay more per month, but that's okay because I don't want surprises and I don't want to pay as I go. I just want to pay one thing a month. I know I'm going to pay more, but I just want to pay one thing a month and be done with it. Other people say, you know what? I can save up for when things happen to me. And so I don't really want to pay a lot per month, or I can't pay a lot per month. And so those are two different illustrations of different levels of risk tolerance. The first person, they don't tolerate risk very well. They just want to pay what they've got to pay and not be surprised. The other scenario is someone who can tolerate risk and can maybe save when they have a medical issue that requires payment. And so those people may make different choices to supplement their Medicare. So the first person would be someone that has Medicare A and B and purchases a Medigap plan. The other person, it might be someone who has Medicare Parts A and B and purchases or enrolls in an Advantage plan, which we really haven't touched on much. So it just depends on what your comfort level is for your risk. Sometimes people say if you have significant chronic health decisions or health issues going on and you use a lot of medical care, it comes out cheaper in the long run for you to purchase a Medigap plan. But again, that's entirely someone's individual decision. We do not encourage people one way or the other. We just make sure they understand what their options are.
Perfect. Okay, Susan, thank you so much for that information. I know this is valuable for a lot of people watching, so thank you for joining us.
Glad to do it. Thank you for asking.
Thanks again to all of our guests for joining us today to answer all the questions on Medicare. Next week, we'll be learning about the Southwestern Indiana Honor Flight Program and how it contributes to our local veterans and community. Thanks for watching WNIN Newsmakers.